May is Mental Health Awareness Month, and we're kicking it off with a conversation this morning with the Executive Director of the Massachusetts Association for Mental Health, Dr. Danna Mauch, joining us this morning. We appreciate it, Doctor. We know the pandemic has taken a toll on so many, both physically and mentally, on multiple fronts over the last couple of years. So how's that added to the significance of what this month's all about?
Well, it couldn't be more important that we have this opportunity to shine a light on mental health and well-being, given what we've all been through in COVID. You know, during that period, prior to COVID, more than 1 in 5 kids, but about 20% of kids had challenges with their mental health and well-being. Since COVID, that number has increased triple the amount. More than 60% of children and youth reporting impacts on their behavioral health, and 71% of parents reporting those disruptions. With adults, we've seen a 4-fold increase in the number of people who've had their mental health and well-being disrupted. It's really critical that we have options to address these needs, because people are willing finally to have a conversation about this, understanding that this external force of the pandemic caused these challenges to our mental health. And people are very much, for the first time in some cases, wanting to talk about this, wanting to get help. We've seen a big increase in visits to emergency rooms, and we're trying very hard to respond to that. The Commonwealth is undertaking an important effort to establish a new front door to the system of care, where there's no wrong access through a telephonic line that will operate 24 hours a day, 7 days a week, starting in the beginning of 2023. There's also an important new service, urgent care for behavioral health, that again the Commonwealth is initiating under its roadmap for ambulatory behavioral health reform. And that will not only treat.
Sorry to jump in, but what are the biggest hurdles that you have faced in starting that conversation, talking about how some people are becoming more and more willing to have that conversation?
Well, there's always been a stigma associated with mental illness and mental health and behavioral health conditions. And people have been, concerned and nervous and about talking about things where they think someone may have a negative judgment or think that having one of these conditions is a failure of will. Again, I think that the pandemic has upended those faulty assumptions, and we've all come to understand that these are shared human conditions impacted by traumatic stress in our environments, which certainly the COVID-19 pandemic has been.
An important conversation. This is just the start of it here to begin this month. Dr. Danna Mauch, we appreciate you for your time here this morning on a Sunday.